So, welcome to this Monday's edition of our media update and live stream. Thank you all for tuning in. And hopefully, everyone had a good weekend and a good Mother's Day. A little chippy out there, a little cool, but hopefully, Mother's Day was a warm day for all of families out there that celebrate the great contributions of all the mothers out there. This week is also a National Nursing Week, and I'd like to thank and recognize all the major nurses across all the nurses across our city for their dedication, compassion, and sacrifice they're making while caring for our community, especially during this COVID-19 pandemic. Of course, we could say that about nurses generally. And a special shout out for epidemiologist nurse in Cornwall, sister-in-law of mine, that Isabel Gamache, that continues to share some of her challenges and journeys as they perform their duties in our community. Not an easy task at this moment in time, and we thank them all for their effort. The federal government also made some announcements today, the creation of a large employer emergency financing facility, short form is LEAF, to provide bridge financing to Canada's largest employers. The intention is to have that financing and support go to workers, not executives or shareholders, but for workers to keep and maintain their jobs. And I think that's critically important. So a good announcement from the federal government to help with the liquidity of some of our largest industries and businesses, over $300 million corporate entities that may or may not need assistance going forward. So this is going to be an important part of them positioning themselves for economic recovery as well. And we know that every sector in our economy is having challenges, and so supports, I think, are going to continue to be important for individuals, employees that need to help to support the companies that they work for. Provincial announcements also in terms of retail stores with entrances on curbside being able to pick up and deliver as of today. And as well, over the weekend, the garden centers, nurseries, hardware stores, and safety supply stores began offering in-store purchasing. So an ability for them to get at the Canadian Tires, the Home Depots, the Lowe's, all of the other home hardwares and garden centers were all opened as of this Saturday. I'm sure there's probably a busy time for all of them over the weekend. And with physical separation, the order of the day for all of them to make sure that they follow all the guidelines, including physical separation, washing their hands, protections for both the employees as well as the attendees or customers. So very important that that happens. The province plans to help seniors as well by paying higher costs for prescription medications during the pandemic. So with pharmacies only dispensing 1 month's supply at a time, the province is working on a plan that would help seniors until drug shortages become less of a problem so that medications can be dispensed in 3 month supplies. Probably a help and assistance for those that are needing some consistency in their medications. And some important information is always on our city website. So all of these announcements you can find on our website at hamilton.ca/coronavirus/financial support individuals. I'm sure you got that, and hopefully it's on the screen for you to read and take note of. In terms of city updates, the Emergency Operations Center continues to work on a plan to reopen Hamilton, and beginning today, you'll start to see a new branding campaign called Hamilton Reopens. And on Friday, we announced some small changes in reopening our trails and green spaces. And looking ahead, we start to see more of our city slowly and eventually coming back to life. And you'll continue to see this Hamilton Reopens imagery with details about how to safely visit parks, shops, and other spaces in our city. So please stay tuned for more information about Hamilton Reopens, and I'm sure Paul will speak more about this campaign shortly when I pass the torch to him. This weekend, although the weather wasn't ideal, we saw the reopening of our waterfront trails and parking lots adjacent to our parks and rail trails. And I appreciate the community's ongoing effort to maintain that physical distancing or physical separation of 6 feet or more, or some now say 7 feet in terms of 2 meters. Very important that we continue to do that. And I was not on the trails this weekend, but I have no doubt that they, even though the weather was cool, people got out and about and enjoyed that freedom to roam, but still doing it safely, maintaining that safe physical distancing that is so important no matter where we are and where we're going as of now. A motion is coming on Wednesday to allow restaurants to expand patios into the roads and parking lots. That is, if and when the province announces that restaurants can reopen. This would then allow for them to have additional capacity on the sidewalk or road if we happen to close it, to allow for better sustainability for the restaurants. It was a motion put forward by the downtown councillor, Ward 2 Councillor Jason Farr. And as you might expect, many restaurants are downtown, but certainly applies to any other locations. And there's a prescribed process for that, including BIAs and other businesses in the area that would have to also approve. But an opportunity to provide restaurants a little bit more space and room to serve more customers and provide better sustainability when the province decides to open up restaurants full time again. So something to look forward to and something to start thinking about, and certainly some out of the box thinking in terms of what we may need to do for the restaurant sector as well as other struggling sectors in our community. We have to be creative. The job numbers released by StatsCan show that Hamilton lost about 18,000 jobs between March and April. That is slightly better than our neighboring municipalities and the provincial and national averages, but the employment rate was up to 7.6% in April, up from 5.9% in March. So the highest unemployment rate in the Hamilton area since the 2009 recession. So it's a significant number and certainly requires some addressing. But across Canada, some 2 million jobs were lost in April as a result of the virus. So hopefully many of those jobs can come back as we slowly integrate employment and opening doors in our community based on whatever the virus is doing and the advice of public health. A reminder that outdoor activities can be enjoyed in the city parks as long as they're done so with the provincial orders and PHS Public Health Service guidelines. So visit our website. So parks are open. By provincial order, the amenities in the park are still closed. The play structures, the swings, the anything else in terms of climbing apparatus, benches, in fact, are technically still closed. So don't use those. They're closed by provincial order, and hopefully sometime in the near future they can be opened up. But as it stands right now, they are closed. Enforcement numbers, continue to hold steady. About 145 total charges, but based on the emergency provincial act, and 2 charges still on social distancing. So no significant change as a result of the weekend or other activities. And I'm going to pass it now to Paul. So, Paul, any updates on the city side in terms of activities that are happening or planned for coming up into the near future?
Well, thanks, Mr. Mayor, and I'm going to start where you encouraged us all to thank a nurse. I'm going to thank a couple of nurses that in my job as the general manager of Healthy and Safe Communities at our leadership team, we have 2 nurses. One, of course, is Holly Eduardi, who's the senior administrator of our long-term care facilities, and Holly is not only a tremendous administrator of our long-term care facilities, but she's a great nurse as well. The second is Jen Vickers-Manson, and Jen is in public health services and is also our chief nursing officer. And I know that Dr. Richardson relies on her work in terms of being our chief nursing officer. She's a passionate nurse and right now is redeployed, as so many people are, to help with our COVID efforts. So thank you to the 2 nurses that sit around our leadership team table in Healthy and Safe Communities each and every day. In terms of what's happening in the city, you talked a little bit about rebranding, and what we're trying to do is draw attention when we are releasing information that is about new things happening in our community and new activities or things that are opening up in our community, that you'll be able to quickly tell that. Of course, we're not suggesting for a moment that by branding something as Hamilton reopens, that everything is reopening. You'll need to read the information that's there and be aware of what you can do and what you still can't do. And the mayor's gone through a number of those things. So we just thought it was a nice way to visually identify when things are changing, because over the next number of weeks, as you've seen, even last week, there are changes that occur and things that are now available for people to enjoy doing, or things that provincially are announced, to which the city is also encouraging people to participate in. So we'll continue to do that as part of an exercise in these next number of weeks and months, gradually reopening and restarting some important services and activities in our community. I have mentioned it a few times, but I will mention it again that we do have a team working every day, a dedicated team looking at the reopening strategy for the city of Hamilton. And that's really how we will restart services that we deliver as the city of Hamilton, but also how we will ensure the assets of the city of Hamilton can be safely enjoyed by the public when those opportunities take place, when they can take place, but also as things start to ramp up. So with retail starting to have opportunities to do some curbside things, that brings more people back to work. And as things happen that are outside of the city's control in terms of its governance, we need to react as well with the services that the city provide to support employees, to support people that are moving around the community. And we're doing that work now. It's going to take us a couple more weeks at least to do this. There are so many things. We're starting with the underpinnings of our occupational health and safety work. What do we need to do to keep our own staff safe and those who use services safe as well? And once we have that foundation, then we'll start to look at what are the services that we would think to restart or offer to the community first, and what are those things that are going to take us a little bit of time. And you can imagine, just like every other business, we're having to look at not only the physical infrastructure of the spaces we occupy at the city, but also the operational impacts of COVID as we move forward. And in our case, we have our buildings are not the same. They're not cookie cutter approaches. They're not franchisee type stores that generally have the same layout. Many of our things are very different. So we're actually having to go workplace by workplace, service by service, and examine those things. And I want to commend the team that's thinking through it each and every day. And as soon as we're able to pull that together, we'll certainly be ensuring that council and the community are aware of where we see this city going in terms of reopening. That will take weeks and months to fully implement. This is not a plan that will be executed over a few days. It is a plan that will be executed in terms of weeks and months. And some of the elements will be here for an unlimited amount of time until we have another strategy in order to remove ourselves from some of the very basics of the public health guidance around how to keep ourselves safe. So that is the work that is certainly preoccupying our time at the EOC, as rightly it should, as things start to change in our community. And a lot of the questions that people have and a lot of the questions that people ask about, are we looking at this and are we looking at that? The answers are generally yes. If it has to do with the existing services or infrastructure of the city, we're playing through a number of scenarios and looking at a number of scenarios. And so I think when those come forward, that obviously will allow council to understand some thinking we have based on the best evidence that we can glean from Dr. Richardson and her colleagues provincially and federally, but also where we really do see us making those right types of moves first as the city, recognizing the kinds of things the community want to interact with. So I'll leave it at that and pass it over to Dr. Richardson.
Thanks very much, Paul. That was a great way to lead in, Mr. Mayor, with the Thank a Nurse piece, and just wonderful for Nursing Week to recognize all of the great nurses that we work with. In Hamilton Public Health, we have so many colleagues, so many nursing colleagues who are working on the front lines of COVID in response, whether it's in our shelters and supporting people there, whether it is answering the phones and making the phone calls. And we also have nurses who are still back in our usual business of doing the most essential services that we provide to our community. The new moms and families who are greeting new little ones into the world in a very different way than they had ever planned to, and many other services that are continuing on. So many thanks to all of them, along with those nurses in management, like Jen, who's our Chief Nursing Officer, and many others who are working with us, and some retired nurses who came back to work with us too, like Debbie Sheehan and Colleen Van Berkel and Glenda MacArthur. So a very big thank you to all of them. Today, we're at 494 confirmed cases as of noon today, 489 lab confirmed and 5 probable, and there's lots more details on the website as always. 350 of those cases are resolved, so that's 71% that have recovered, which is really good news. And part of that is too that a lot of the cases we've been detecting lately are ones that come through that mass screening that we're doing in long-term care homes, as well as now childcare agencies as well. And so, these aren't people that were sick to begin with, and so a number of them get marked up to being resolved even faster. We do unfortunately have one new death to tell you about today. This is an 82-year-old gentleman from the Cardinal Retirement Residence who just passed away on May 9th, so over the weekend. And our thoughts and go out, and condolences go out to the family and all of those who have lost a loved one during this outbreak. It's sadly so that some of our most vulnerable in our community are the ones that suffer the most as we go through this experience. We do in total have 7 institutional outbreaks and 1 community outbreak that are outlined on the website. I do just want to take a moment to come back to the false positive issue that we started to understand on Friday and have learned more about over the weekend. So as we explained, we were notified by Public Health Ontario Lab that they suspected there might be false positive results related to 10 confirmed staff cases at Macassa Lodge. Now there, of course, we act quickly on the information that we get when we get the lab testing, and the home had started to put in place outbreak measures, as well as we were working with the individuals involved. And then late on Friday afternoon, we learned that all 10 of those cases were definitely negative. And it is a process that the lab goes through. They first called us to let us know they thought there might be an issue and that they were going to run some additional tests. And it wasn't until later that afternoon, I think it was well after 4, that we heard from them to say that those 10 cases were definitely negative. And then we had to go through the process, of course, of notifying everybody related to that. In addition, we did find out over the weekend, beginning late last night, that there might be additional false positives beyond those first 10. So based on the information we have now, it looks like there may be 7 more that are false positives, and the lab is in the process of rerunning all of those tests using another using another method. And if they turn out to be negative, as well, it will also impact the outbreak data as well as the total number of cases that I just spoke to. So we're going through that process. It does take us a little time. And I know that that's difficult. I know that this situation, when we have this happen with our laboratory testing, it causes a lot of stress on the people who are affected and the institutions that are affected, especially a time when anxiety is already heightened. So some people may be relieved to find out that they didn't test positive, and that's great. But of course, the stress, fear, and inconvenience that comes along with that, and for our institutions, when they find out they or their families, their loved ones, have experienced this during this whole outbreak, it's very unfortunate. So we are working very closely with the Public Health Ontario Lab to confirm the details, and we'll provide updates as soon as they become available. You'll remember that we are doing this mass testing in long-term care facilities, and we did, as we talked about on Friday, we've already surpassed our target of achieving 50% completion by the end of last week. Actually, we had surpassed that by Wednesday, I think it was. And the remainder will be done by Friday. At this point, we're at 96% complete amongst all residents. And in fact, we don't expect to get to a higher number than that, because everybody has the ability to decide whether they want to be tested or not. And some of those tests had already been done outside of the specific initiative in terms of outbreaks and that sort of thing. So we actually consider all the resident testing to be complete at this point. And among the long-term care home staff, we're at 89% complete. Again, well on our way to the target of completing this by the end of the week. The challenge around staff is, of course, they do work shifts and they need to come in and be tested, and some staff are on LOAs. So we're just working through all of that to finalize those numbers and get the last tests in. So overall, 92% done. Childcare wise, we have 112 staff that have tested so far. And so we are looking to complete that testing over the course of this week as well. So that's the update from me. Back to you, Mr. Mayor.
Thank you very much. And yeah, unfortunately, these false positives causes a lot of undue stress on families, and fully understandable when you had 270 residents at Macassa, for instance, or others, the 7 you mentioned, how difficult it is to get that first word that you potentially have it, and then to be told afterwards you don't. Nobody needs that stress, but the good news is that false positive is still a negative, and that means that they don't have it. So sadly, they have to go through that process, and I'm sure that we commiserate with all of those that were kind of stuck in that process, and encourage the labs to minimize that as much as humanly possible. I do want to give a shout out to the Royal Canadian Air Force snowbirds. They flew over Hamilton, 9 planes flying over Hamilton on Sunday. My friend of mine, Karen Chrysler, sent me a nice video from her shot from City Hall as they flew over, quite dramatic, and I'm sure enjoyed by many, as a salute to all those frontline workers that are working in our community. So they've been doing this across the country, and certainly we appreciate the flyover. It was supposed to originally happen on Saturday, but the weather wasn't suitable. But Sunday they managed to do it, and I think it was well appreciated. Shout out to the Canadian Liquid Processors Limited Corporation as well, a company that's retooled their operations to make hand sanitizers. Company takes stale and unusable alcohol beverages and turns it into ethanol. And that is, of course, the key ingredient to hand sanitizer. So they've donated an initial batch to the Hamilton Paramedic Service and are now producing 4,000 liters of hand sanitizers per day and shipping them to emergency services, fire departments, and homeless shelters right across the country. So thank you to the plant manager, Sean O'Neill, and his entire team at Canadian Liquid Processors. Well done. And lastly, a special shout out to our 10-year-old Peyton Nichols. Peyton is using colored chalk to write inspirational messages on a sidewalk in her North End neighborhood, including sayings like, stay at home, never give up, and we can do this, Canada. So thank you, Peyton, for that inspiring message on our sidewalks. And I see many others in our community doing similar kinds of inspirational messages to help one another get through this very difficult and challenging time. So thank you, Peyton Nichols, for that inspiring piece of work. You know what? That doesn't matter what age you are. You can help one another and inspire one another to look at this the right way and hopefully put it into perspective and know that together, collectively, as a country, we're going to get through this pandemic and this virus issue and hopefully come out the other side with learnings and improved, society as a result as well. Thank you, Peyton. So I'm going to go to Jasmine now for some questions from the media, and then we'll wrap up shortly after that. Jasmine?
Thank you, Mr. Mayor. We do have a number of media partners on the phone this morning. We'll start with one question and one follow-up. First question to Samantha Craigs from the CBC. Go ahead, Samantha.
Hi there. My question is for Dr. Richardson. So with the Hamilton Reopens efforts and things looking better, when will we be able to see people we don't live with? See parents or friends who we don't live with? When can we do that?
Yeah, that's a good question, Samantha. As we go forward, exactly when would we do that? So there are some ways we can see them, of course. Now we've talked about window visits at this point, and I think people are gradually starting to think about what can they do in ways that maintain that physical distancing, that that you can practice good hygiene, all of those different initiatives. And I think the advice from the province will come down shortly in terms of when we're ready to move to that next stage, provided we continue to see the decline. We had the lowest number yesterday that we'd had so far since March of cases in the province, which was very good news. So there is, as my own sons remind me, the provision is 5 or less, Mom, around those things. When could we get on to seeing some people? But I think we just need to be patient for a little bit longer to see where we can get it at opening up a little further.
Okay. And I just wanted to ask as well, in terms of a second wave, which we've been told will pretty much be a surety. I'm wondering how locally we will keep an eye on that.
So absolutely, that's a very important part of this, and whether we think of the second wave as we do with influenza, that is more of a seasonal thing. So there's actually the influenza virus behaves differently depending on conditions like humidity. With this virus, there doesn't seem to be so much of a seasonal piece to it, and so we think it's probably going to be more related to the degree of control measures that are in place, things like that physical distancing, hand washing, staying home when you're sick, sort of piece, as well as potentially some buildup of immunity in the population, which is what we're trying to understand how that works at this point. So with us, it's more likely that this piece about opening up and closing down is going to have an impact on whether or not we see an increase in cases. And then what we're doing in terms of tracking that is monitoring those cases in terms of the numbers that we see. And we take in a lot of information when we interview people who have the disease about where did they get it, what could have been the potential risk factors, all of those sorts of things. And so as we collect that information and look at it and try to identify, is it a particular sort of activity, or is it sort of more general spread as we saw at the very beginning of this? Is it related again to travel? Should borders open up? We're going to be watching all of those factors, all that information, both here in Hamilton, but across the province as a whole and across the country to help us understand what the impacts are of the reduction in measures as we go.
Thank you.
Thanks, Dr. Richardson. Next question goes to Matt Ingram from CHCH. Matt, you can go ahead.
Thanks very much for taking my question. This question is for Dr. Richards. Over the last 3 days, I'm seeing that there's been institutional outbreaks declared, Blackadar, the Roslyn, and Idlewild. Can you talk to me a little bit about how that's connected to the mass testing that you're doing? And should we, with you being so close to being finished, are we going to see an end to these kind of cycles of outbreaks being declared with 1 or 2 cases here and there?
Right, that's a really good question, Matt. Some of those outbreaks do relate to the mass testing and identifying some asymptomatic people, whether they're residents or staff, who are positive, and then they do go into outbreak mode. Some of them, though, have still been cases that are ill, that are people who are ill and they have been tested because they've become ill. So we still have both those things that are going on here in Hamilton. So we do expect as we finish off this mass testing that you'll see less of those sort of 1 and 2 person outbreaks that are related to that testing of asymptomatic individuals. But unfortunately, we do still have transmission as well that is occurring. And it just points to, again, the need to be very good at all of those fundamental elements. In a long-term care home, it is about screening of both staff and any essential visitors as to whether or not they have any symptoms. It is about making sure that masks are being used when they should be for care and when they're working in the home. So there's a whole range of things that need to be in place that everybody's doing their very best on, and we need to continue to do those as well to make sure we don't get any further spread.
My follow-up, I'm also noticing that 1 outbreak was declared over at St. Elizabeth's Villa, and I think overall 7 institutional outbreaks is much less than there was last week when we did this. I think it was at 10 last week. Could you talk to me a little bit about what happened at St. Elizabeth's Villa? Was everyone tested before the outbreak was declared over?
Hi, Matt. I don't actually have all those specifics with me. Perhaps I can get one of my colleagues to follow up with you about the specifics related to St. Elizabeth's.
Thanks, Dr. Richardson. Next question will go to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. My first question is to ask why we're having suddenly this problem with false positives that we seem to have 7 more. Can you talk about why this is happening?
Yeah, thanks, Joanna. It's, with any lab test, whatever it's for, they do a quality assurance. They monitor very closely the results they're getting. And if they see anything that's unusual, as they did in this case, they saw a number of positives coming up amongst asymptomatic individuals, which is not the usual. So it does happen when you're testing symptomatic individuals, but they saw more than they had been seeing otherwise in these asymptomatic tests. And so they flagged that as they were going over their own results and said, okay, we think there might be something here, called us and said, let's take a look at this and see what's going on. Let's use some other confirmatory tests, use a different lab to run the tests. And then they found that they were indeed negative. So that does happen at times. And it's part, as I said, of the quality control that goes on. And then, of course, when they find an issue, they do look to see if there's anything else that might have happened. And so my colleagues at the lab, I can only imagine scouring through, all of the thousands of tests that they're producing. Every day they went back through them to see if they were things related to, the equipment being used, the what we call reagents that have been used, the chemicals that are used in the process, and to try and find those things. So they're very much going through that and looking to see if there's anything else, and then looking to make sure that that those issues are resolved.
Hey, thanks so much. The second thing is I'm a bit confused by the timeline here because I was told by public health at 3:30 p.m. It was actually right before the briefing that there were no cases at Macassa Lodge and that this would be addressed at the briefing. It was not addressed at the briefing, so I asked Dr. Harvey about it. That the testing was completed Friday morning and that it was all false positives. Now you say public health wasn't informed until late afternoon, 4 or later. Can you address the discrepancies here and why it would take so long for them to tell you there was false positives if they had that answer in the morning?
Sure, absolutely. So that's what I was describing, Joanna, about the fact that they called us up to let us know that they believed they had false positives. And so let us know that on Friday morning. And so that was our understanding. And they also went on to go through and do additional tests to make sure of those things. So you can imagine when a test comes back and it's different, you need to do a little bit more to make sure you're absolutely convinced of it. And so they went on to do additional testing. And so that was confirmed with us later that afternoon that indeed all that had been done, complete, and they were absolutely satisfied that it was negative.
That is not what Dr. Harvey said. Dr. Harvey said that you were called first Thursday night to say there was a problem and that the retesting was done Thursday night and Friday morning, and that as of Friday morning, it was determined those were false positives. So there is a lot of problems with this timeline here.
So Joanna, why don't you let me take that back? That's the information that I understand from this one. And, I think if there's some error in terms of, when an email is received, when something's sent, then we'll absolutely get back to you on that. But that's my understanding as of now, and happy to provide you anything further we can find.
Thanks, Dr. Richardson. Next question will go to Lisa Pileski from CHML. Lisa, you can go ahead.
Thanks very much. I was just wondering, in terms of, as we talk about reopening the city in a lot of different ways, obviously not all at once, like Paul said, it's going to take many months. I'm just wondering about the measures that have been put in place to assist the city's homeless population at this time. The washrooms at York and Bay, the opening up the First Ontario Centre as a temporary shelter and other things like that, and the hotel rooms as well. How are those going to be addressed as those services eventually reopen to the public?
So thanks for that question. It's a very important one, and it's a big part of that element of our reopening strategy. The bottom line is we cannot go back to what we were experiencing in January and February of this year. We had times where our shelters were at over 100%. That means people are sleeping in bunk beds. People are sleeping too close together. There are too many people using that space. We also know that some of the temporary measures we put in the emergency are not sustainable long term. So the challenge for us is, unlike other congregate settings that do have maximums and do have other ways of dealing with the populations that are in them in long-term care facilities or retirement homes, we're going to have to think very differently about emergency shelters moving forward. And we're going to have to look at the services that need to be in place for much longer than a few weeks or much longer than through what I'll call the highest crisis point of this pandemic. This is going to go on for a while. And so we also can't rebuild the entire shelter system in a matter of weeks. So we have a number of things to look at, but I can assure you that the answer to that particular part of our reopening strategy is not to shut down the things that we've been doing and say to the shelters, I hope you can manage with what you have. We're going to work with that system and bring forward some ideas about what we see happening in the short term, the medium term, and not for decision out of the EOC, but I can tell you that I believe over the coming years, in the same way that we're probably going to relook at how long-term care facilities were constructed and their mode of operation. I absolutely positively believe we need to do the same thing with an emergency shelter system. And so I think there will be a number of years of work that need to happen in all communities that experience high levels of homelessness and have that infrastructure around it to look very differently at how we provide that type of shelter and what we should be doing, not just through this pandemic, but also setting ourselves up for the recognition that infection control in congregate settings is something that is very hard to do in the current configuration. And we should be preparing and using the lessons of this pandemic to help us build a better temporary shelter system moving forward. The other piece is that we have a good, robust strategy around how we find people permanent housing, and I think we have to accelerate in all capacities the ability of us to find more permanent accommodations for folks. But that is a wonderful ideal and something that certainly we're pushing on as the city of Hamilton. But in a city of 540,000 people, there will always be a need for some level of emergency shelter. We know that. So I think it's how we best do that alongside a push to have that system be as small as possible and have as many people as possible in permanent housing.
Okay, thanks. And in kind of in keeping with that, I mean, that's the long-term plan. So in the short term, though, I know are certain groups like Ham Smart and Keeping Six that are calling on the city not to break up the temporary the congregate outdoor living stations that people are living in when they don't choose to be in the shelter system. Just your response to that call for putting a moratorium on breaking up those outdoor shelter situations.
So we're putting our energies into more outreach workers. So we've actually redeployed some people to help augment the current outreach team that, quite frankly, was overstretched to provide support there. We've accelerated our efforts to have access to social housing units to move people actually sometimes directly into permanent housing. And we do have capacity within hotels and shelters that we believe are safe opportunities for shelter. So at this stage, we're not seeing a change of that, and that'll continue to be our analysis of it right now. And I do think that we're turning our mind now to what does the little bit longer term look like. But as of today, we'll continue to do that outreach. We'll continue to work with partners. It's an approach that seeks to get people into a more safe environment than quite frankly, large encampments. I'm not convinced are the safest option here. So we're working very hard to do the right thing and bring people into the right kinds of shelter environments. And I'd call on everybody to focus their energies on that and work with us about what that looks like. And I think we do have options right now in the city to make that our primary approach. And if that was to change at some point, we'd certainly change that. But I'm not convinced that now's the time to do that.
Thanks very much.
Thanks, Paul. Next question goes to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks. My question's for Dr. Richardson. With the 7 positive or false positive cases, are they from the community or are they from long-term care settings? Where are they from and when were those people tested?
Hi, Katrina. So these are mainly from long-term care home settings. Again, it's part of this, the majority of our tests over the last 10 days have been long-term care home residents because that's who we've been out doing mass testing within the 7,400 tests that we've done over the last week or so. So they are mainly from that group. I can't tell you specifics on each one and when they were tested. This is when we got the results in. But we are moving through them and working with the lab, making sure we've got the best results that we can, and then looking to notify people about those results.
Thank you. And I'm also wondering, with these numerous cases coming up now, how do we know that there aren't more out there, and how do we know that the lab is reliable right now?
Absolutely, and that to completely understand people being concerned and wondering about, how to interpret the tests and whether or not they can rely on them. So, we feel the same way that others do. We want to make sure that we can, and the lab knows that too. These are all very professional individuals who want to make sure that they're doing the very best work that they can. And so when we look at this out of, as I said, even just that 7,400 tests that we've done in the last 10 days or so, with 18 of those being false positives, it's a very low number. They were detected very quickly by the lab in terms of when they were being run and them noticing trends and then them following up to see if there's any other ones that could have been an issue. This is absolutely a new virus and new tests, and they are working out any issues that they detect very, very quickly. And so I have a lot of confidence in our lab and our lab colleagues here in Hamilton as well, who do a lot of the testing, and those in Toronto. And so, by and large, this test is going to be right 99% of the time. And there will be, unfortunately, those few cases where there's an error or a challenge. And, I have a lot of confidence in the fact that they found it quickly and followed up.
Thanks, Dr. Richardson. With that, Mr. Mayor, that's the end of our media questions, and I'll pass it back to you for some closing remarks.
Okay, thank you, Dr. Richardson. Thank you, Paul, and media, and anyone else that tuned in today. Hopefully, some additional information for you in terms of how we're faring in terms of the whole virus situation in Hamilton. I want to thank Rosalie Visers and Georgia Whalen, our American Sign Language interpreters. Of course, Cable 14 and Bill Custers and the entire team for continuing to broadcast and help us through this, as well as McLean Media to make sure that we're running smoothly here as we're making these presentations. And of course, as always, all of our frontline workers, whether they be nurses, which we celebrate this week, paramedics, healthcare workers in every form, public health and otherwise, police officers, grocery store workers, pharmacists, truck drivers, all the folks that are bringing maintaining the supply chain and all the goods that we consume or need to consume, as well as janitorial staff that are now have an enhanced role in terms of cleaning door handles and countertops and anything that we might touch, in our operations, both wherever you are and whatever location you're working from. And all those that are producing food. So lots of folks have got their shoulder to the wheel to make sure our city remains functional, and we thank them all for their effort. And we thank all of you. Clearly these are still difficult times, and each and every day we get, some lightening up and some good news, but we're not out of the woods by any stretch. And there's much more patience to be had here, both for individuals that are self-isolating at home as much as humanly possible, not able to see their grandchildren or family members as yet. We're all looking forward to and yearning for that time, but it needs to be done at the right time and safely based on what our public health officials tell us is appropriate at any given time. So thank you for your efforts. Again, we understand and appreciate it's difficult. It hasn't changed any in terms of difficulty, although we might all be getting a little bit more used to this environment. But it still requires patience, and be patient with the folks at the checkout counters in the grocery store. It's not their fault that one has to wait a little bit longer. It's just the environment that we're currently operating in, and so don't take it out on those that are trying to help. And maintain your patience and maintain your help and assistance to your friends and family in our community that need our help and assistance. So if you can help others, like the positive message of Peyton, look after one another, help one another as much as you can. And I know our government is doing everything it can to help individuals in our community, as well as we are at the City of Hamilton and the province of Ontario. So thank you for tuning in, and stay well, stay patient, look after one another, and we'll see you on Wednesday for our town hall, where we can field some more additional questions from the community at large. Thanks for tuning in, and we'll see you on Wednesday.